Hello and welcome back to Panama for Real. Today we're back with Dr. Pablo Noel, who's our medical expert here on the channel. Dr. Pablo, welcome back. How are you?
It's a pleasure. Thank you.
Good to see you again. Today we're going to touch on something that when I first came to Panama, I'd never heard of any of these things, and after about a year of being here, it hit home personally because my girlfriend got one of these conditions. Dengue fever. We have dengue fever, we have chikungunya, and there's Zika. Now, they're all
similar,
and they're all mosquito borne.
And viruses.
And they're viruses.
Yes.
What are they? I know that they can be serious, and what can people do about them?
Yes, well, the three of them, they very similar on the symptoms and the clinical manifestations. The problem with Zika is that that it could have very serious complications on the babies that are in pregnant women, and most of the problem is not on the pregnant women but on the baby, that will have some complications, more of them related to the neurological complications, so it could be very serious. So those are the most affected population, the area of the population. The other one is the chikungunya. This one will have some consequences I think a third of the patients will have a back pain problem that will last for many years because it affects the joints in a very serious way, and some of them will have this problem after the disease that is like a consequence that is very difficult to treat, most of the times irreversible. But the good thing about Zika and chikungunya is that we haven't had another break since 2018. That actually was the first break and the only break that we have in Panama. So we are thinking that it probably was imported and very easy to spread. But since then, we haven't had another one, so that's a good thing. I wouldn't be concerned of Zika and chikungunya in Panama, less in the city. The problem in the city and some parts of the country, most of them, the places that rain a lot, is the dengue, right? So dengue, it's very relapsing in Panama. So we have a break every year. It's endemic, in definition. So we are really we know a lot about dengue actually, because we have to see it every year. The problem with this are the mosquitoes. So we have to take really a lot of concern about not breeding any mosquitoes around the house, because that's the biggest risk. So we recommend, do not have any type of pooled water around the plants or anywhere in the house, less in the balcony or in the backyard or in the garden, because these are the places that the mosquitoes will breed, and they will go and
and they're quick, aren't they? They will breed quickly,
and they're very difficult to see.
Yes.
And you won't feel them. So that's the problem with those.
So no puddles. If it's rained and there's a puddle on the balcony or in your backyard, get rid of it. Don't allow. We have plant pots on our terrace, and when we overwater them, you get in the plate underneath, in the tray underneath, you'll get water gathering or pooling. You got to get rid of that too. Yeah. It's common sense.
And use the repellent, mosquito repellent. Normally the mosquito bites will start after 3 o'clock in the afternoon. So that's the time you got to start using the repellent, every 3 hours or so. If you're in an apartment with your windows closed, air conditioning on, it's very very rare that you'll have one. But if you're in a trip or whatever, or in the streets, you got to be careful. It's not like you will have it every day. I never had it. I'm in Panama all my life, but you never know. So you got to be careful. But it's not a life-threatening condition. if you only had it once. So the problem here, if you have a second time, if you have the dengue in a second time with the same subtype of virus, so you have 4 subtypes, and if you get bitten by a mosquito with the same subtype of the virus that you had before, you will have a worse dengue disease that might have some risk of life-threatening condition. But it's very rare that you will have, you know, this 2 times subtype of the virus.
You'd have to be pretty unlucky.
You have to be really unlucky,
yeah.
and most of the times are Panamanians, you know, that they live here and been here for a lot of years. But it's really rare. The good thing about dengue, if you take you eliminate the risk factors, you're very probably you will never have it. And if you do have it, you know, it's gonna start with high fever, joint pain, weakness, maybe some diarrhea sometimes, nausea, vomiting. You will feel really sick, but it's gonna go away in a few days. The good thing is that you know, the emergency rooms, all the clinics, almost all doctors in Panama well trained in dengue, because we see it so much. That's part of our training. So you will have the best attention that you will find in the world, because these doctors, yeah, they know what they're doing. So they won't hesitate on the diagnosis, on the treatment.
Perfect. There is well, people believe that the higher you are in a building, the safer you are as well. I know
it is so. I mean,
yeah.
it's not that you will never get a mosquito bite if you're in the fifth floor, but in the 50th floor. But it's very unlikely. It's very unlikely that you have.
Yeah, you mentioned the 11th floor. As long as you're above the
that's what they say. You know, above the 11th floor, you're okay.
Right.
But you know, mosquitoes are really smart. So
yeah, and as I said to you, I once lived on the 42nd floor of a building, and from time to time we would get mosquitoes in there, and I was convinced they were learning to use the elevator to get up there. But Dr. Pablo, that's really, really helpful and reassuring, I think, for the viewers, because rumors go around about dengue and chikungunya here all the time. Zika, I know it was a very temporary thing. Chikungunya sounds like that's not really a threat, but dengue, I know someone who had dengue, and he wouldn't wish it on his worst enemy. My girlfriend had chikungunya when it was here.
Yeah, it's very symptomatic.
That was terrible. She was so sick.
Yeah.
So thank you very much for the advice, and we'll see you in the next show.
Thank you so much.